Wendy Kelly, and I'm a clinical psychologist and the clinical director for Louisiana's Office for Citizens with Developmental Disabilities. Today, I'd like to talk a little bit about the applicability of cognitive behavior therapy, or CBT, for individuals with intellectual and developmental disabilities, or IDD, including autism. I'd like to start out with this basic fact. First-line treatments work for most individuals. This is easy to understand when we talk about medical health treatment, but this also applies to mental health treatment. Just like when a physician accounts for someone's age or weight, some personalization or adjustments may be needed. So what I'd like you to know is that the applicability of cognitive behavior therapy for people with IDD just needs a few modifications to personalize it and make it effective for your individual. And you may find that some of these modifications would and could be used for other folks without IDD too. Our first adjustment is to how we present the idea of CBT. Here, our focus is to help the person understand how negative thinking can impact both mood and behavior, and more so, that thinking differently can be a way to improve mood, anxiety, and other behavioral health symptoms. To help the person to understand the CBT model, we focus on the most basic unit of CBT, or thoughts change feelings. To help you feel more comfortable using CBT with individuals who may have an IDD, here are 3 areas for modifications to use with folks with IDD. The first area will focus on 6 modifications for the use of language and communication. First, use language the person understands, meaning get to know what the person likes or is knowledgeable about. For example, if they are a sports fan, you may use sports terms or idioms that also reflect their level of education and literacy. Use concrete language as much as possible. Second, carefully consider the wording of questions, avoiding overuse of yes or no questions, considering a balance of open and closed-ended questions, and the use of compound questions, mainly because some individuals will struggle with lengthy questions. And consider how or if abstract concepts are useful. Third, slow down the rate of speaking because this may help people with IDD process your questions and directions, even if what you said is a more complex or compound message. Other things you can do are to give simple messages, present one topic at a time, and be specific. Fourth, give sufficient time to process and respond to questions. Sometimes when a response is not given quick enough, there is an urge to re-ask the question, causing the person to then reconsider the original question, or worse, consider the question in a new way. Now, the person has to take even longer to give a response to the original question because they're processing the new information. Fifth, use visuals and art in communication too. Many people with IDD or autism are visual thinkers. Provide folks with images to illustrate directions and tasks. Use visual aids when teaching skills, and encourage the person to draw, paint, or sculpt their thoughts and feelings. And the 6th and final modification is to be sure to confirm understanding. This goes both ways, ensuring that they are understanding you and that you are understanding them as well. So it is good to clarify that their vocabulary is your vocabulary, and their understanding of concepts is your understanding of concepts too. To review the communication modifications for CBT, 1, adapt language so the person understands. 2, avoid abstract concepts or too much focus on yes or no questions. 3, slow down. 4, give sufficient time. 5, use visuals and arts. And 6, confirm understanding. Since CBT includes building skills someone may not have, the second area for CBT modifications focuses on 7 skill-building components. The first approach is to teach skills concretely. This can be done in a number of ways. Remember, we mentioned that some people are visual learners. Some people are also experiential learners, so it may be helpful to allow the person to immediately experience the impact of thoughts on feelings as a way to make a relationship concrete. The use of social stories may also aid in the person learning skills by showing them what to expect, the most appropriate response, and even what others are thinking. A second component involves modeling to teach skills. Here, the therapist models for the person before asking the person to demonstrate the skills. A third component includes extra practice, so the person overlearns the skill. This can be done by using more repetition and review, along with shaping approximations to the terminal target skill, teaching in steps, and using positive reinforcement. Fourth component involves use of role play and in-session play to solidify concepts, give practice, and reinforce skills. The fifth component is teaching an emotional vocabulary. This will be helpful to understand the role of thoughts on behaviors and emotions. The person may not have the words to recognize, label, and understand feelings. There may need to be some time spent in early sessions to understand the emotions or feelings the person does recognize and label, and those they may not. You may need to use facial expression pictures to help the person learn to label at least some of the basic emotions you will use in therapy and homework. The sixth component is a shift from using the typical subjective units for rating emotions to teaching a rating scale meaningful to the person. For example, a 5-point scale or a visual facial scale. You can use similar pictures that were used in developing an emotional vocabulary to help with this adaptation. And the seventh part of these modifications is remembering that there is no need to teach labeling and categorization of the negative thoughts. Simply teaching that the person is having a negative thought or a sad thought is sufficient. The benefits of cognitive reframing can be reduced to the easily memorable phrases such as think positive, feel positive, and think negative, feel negative. To review the skill building modifications for CBT, 1, teach concretely and use social stories. 2, model. 3, provide extra practice. 4, role play. 5, teach an emotional vocabulary and how to use it. 6, adjust emotional rating. And 7, do not focus on labeling or categorization of emotions. The final area we will discuss focuses on 7 modifications for the actual CBT session. The first modification is to shorten the session length. Some folks with IDD may have shorter attention spans, and youth can be easily agitated by a sustained session. So adjust the session length according to their attention span. You will also want to adjust the dosage and pacing of gradual exposure. Second, consider that the person could benefit from more frequent sessions to compound learning. A third possible session modification involves preparing for the possibility that therapy or treatment may last longer because of the need for shorter, more frequent, and simply more sessions over a longer period of time. The fourth potential modification is to use routine and structure in your sessions to help cope with the difficulty of change. Create a routine for sessions with opening and closing rituals. Have a consistent meeting day or session time. Also, consider the use of visual agendas for people who benefit from visual presentations. Help family and caregivers create schedules or routines in the home and school when knowing what to expect may help with anxiety or prompt engagement challenges related to depression, such as set times for meals, homework, or bed. A fifth potential modification includes the use of in-session play with children. They may require movement and activation to remain focused. And consider using puppets, figurines, sand play, and dollhouses to create story and metaphor. The sixth session modification focuses on setting clear expectations, meaning the expectations for skills that are going to be worked on in session, as well as the expectation of completing skills homework or out-of-session practice. And the seventh and final session-related modification involves booster sessions for retention. These booster sessions are important for some people with ID, meaning even after skills are mastered, it may be necessary to schedule regular skills practice or provide booster sessions to maintain skill mastery and usage. This will also increase the overall length of therapy. To review the CBT session modifications: 1. Shorten length of session. 2. Consider more frequent sessions. 3. Plan for a longer time in therapy. 4. Structure sessions and adapt agendas. 5. Use in-play session with youth. 6. Set clear expectations. 7. Plan for booster sessions. In this module, we covered modifications across 3 areas related to CBT. 1. Communication. 2. Skill building. And 3. The session itself. It is also important to remember that individuals with IDD often rely on others for support on a day-to-day basis. As you adjust your CBT session approach, you will need to consider the importance of including these supporters in sessions, as well as providing any needed guidance on how they can support the person to practice these skills outside of session. I trust you can use these tips and adapt your CBT for individuals with IDD, including autism, with minimal effort. And I feel confident that these tips are supported by researchers and clinicians who have shown the applicability of cognitive behavior therapy for individuals with IDD. People with IDD experience behavioral health issues at rates higher than the general population. They benefit from the same evidence-based therapeutic interventions, such as CBT, which are used for people without IDD. The provision of CBT for people with IDD is not related to a niche area that requires years of specialized training. Rather, it is a cultural competency on the part of the therapists that typically requires only common sense modifications, which do not impact the core values of the intervention. In this video, we focused on communication and CBT session modifications. There are other modules in this series that may also be helpful for you to view. Thank you for taking the time to listen to this brief presentation.